We welcome back Dr. Sreedhar Potarazu, Vital Spring Technologies president and CEO. He's got both an MBA and, of course, an MD, so he's a good guy to talk about this. These latest numbers, what did you make of them, and does it surprise you at all?
No surprises at all, as you know, Liz and David, that as we sort of scratch, this is sort of the scratch and sniff. The more you scratch this, you find out what the real answer is in this law, and we expect more numbers to come out over the next several weeks as we peel this law back to figure out that there's nothing here that's going to control cost. You know, there's a huge number of folks that are projected to come out of the employer system that will end up in Medicaid. We've seen the private insurance companies who are going to go after the Medicaid market. Costs are going to go up. We've seen the impact to Medicare, that people who are going to get less coverage on Medicare Advantage. We've now got those people who are going to compete with the 21 million people in the exchange, all for the same number of doctors and hospitals. Costs go right back up again. The high-risk insurance pools, that the coverage from the federal government goes away after a couple of years. Premiums go back up. Insurance companies continue to get fatter, and costs are continuing to go out of control.
Well, Doctor, accepting everything you say, it's important to keep in mind, and again, I do accept your stats on this, that this is actually less than 1% of the total cost. That is, this is $311 billion between now and 2019. That's $311 billion out of $35 trillion of healthcare costs. So again, while you may be right and while it may be more than this amount, that's less than 1% of the total.
It seems like, 1% of a big number is still a big number. And my concern, though, is that these are still best estimates. One of the caveats that also came out of the report was that they're not really able to gauge what the expected utilization is going to be. I think the biggest concern, especially around Medicare, is that by cutting some of the coverage in Medicare Advantage, people aren't going to be able to pay for those co-payments. And the fact of those subsidies around the donut hole may end up being a wash because these people can't afford to pay for the same coverage and compete with everybody else. So there are still a lot of unknowns that go beyond the 1% right now that I think are going to be much more. And the fact of the matter is we haven't really gone into the details of the medical device companies in terms of their taxes and how that's going to come back to the consumer. There are so many different elements where, as I said earlier, the insurance companies, which the president said we need to keep under control, we haven't really done that here. They're still raising premiums. United Healthcare is still having, a great quarter and will continue to do well. And we haven't reined in that effect yet, whereas until we do that, costs are going to continue to go up.
But we should also note that Merck came out with news today saying that their costs that had been anticipated from the healthcare plan are not going to be as onerous. So on the one hand, you've got that, but then on the other, you've got Baxter International, which does medical products, and they didn't have great news this week on that front. So there's still so much to be learned, is there not, as it shakes out?
There is. It's interesting, Liz, on the Baxter case, the whole issue of the heparin issue with the mislabeling of those bottles really took them for a swing. And there is a lot of, pushback in terms of the administrative errors, the overuse of medications, the involvement of the pharmaceutical industry. You're absolutely right that there's still a number of dynamics that haven't come out into the wash yet. But I still think that these for-profit companies are going to try to make hay while the sun shines over the next couple of years when things may change.
Well, by the way, I should mention a friend in California has Athena Healthcare, saw his premiums rise 100%, doubled his premiums just in the past 2 months. So it looks like those premiums continue to go up. Everybody's trying to get their licks in before this thing comes into law, right? Well,
and the utilitarian approach about, wanting to get everybody on the bus means that some people are going to get thrown under the bus at some point. And I think that's what we're seeing. Is there going to be some compromises here, whether it's in Medicare, Medicaid, or in the people covered under their, under employers? I'm hearing just unofficially many employers that are saying maybe we'll just drop coverage altogether and just pay the penalty. So the jury's still out.
Dr. Sreedhar Potarazu, thank you very much.
Great to see you, Doctor.
Thank you for having me back.